Well,
So we're here today to give you also, we're going to start with a brief overview of what health visiting school nurses do, because that's always a very good place to start. And this reflects across all of our sites in Hampshire, Southampton, Portsmouth, and the island. And then we've just got a particular focus on around some of the work we do around healthy weights and lifestyles. We won't be going into great depth of clinical advice because actually we have so many resources, and that's how what our service does on its day-to-day bit. So we're signpost for anyone that needs more information, but we can answer some questions around that as we go at the end. Okay, so I'm going to start with our first slide. So who we are. So I think it's always good to cover what health visiting school nurses are, because I think sometimes people are not always aware of them, or you might have had a health visitor if you've had children yourself, and you do roughly remember in those early days when you were sleep deprived, somebody coming round, perhaps weighing your baby, perhaps giving you some advice, but you can't really remember. Or our school nurses, you may have remembered receiving a letter if your child was measured in reception or year 6 for their NCMP. But there is so much more that we do as public health nurses, so that's what we're going to kind of talk through. So a health visitor is a specialist public health nurse who leads the Healthy Child Programme for 0 to 5-year-olds, and that starts in the antenatal period of pregnancy, and they focus on prevention, early identification, and supporting parents to give the children the best start in life. Then our school nurses, they cover 5 to 19 of the Healthy Child Programme, and they support the health and well-being and development through childhood and adolescence and for our young people. Okay. So who's in our team? So our team is made up of many kind of different professionals that help us do this great work across all 4 sites. So we have community nursery nurses who may have worked in nursery settings before, and they're really great practitioners who help support with kind of sleep advice, behavioural, introducing solids, all of those kind of things that parents need in those early years, and adjusting to having a little person in their life. And then we have our community staff nurses who are registered nurses who provide a lot of our contacts under direction of the health visitor or school nurse. We have support workers, and we also have the foundation of any good team, which is our admin support workers, which makes sure we get to the right places and that all of our clinics run as they should do. And together we form the public health nursing workforce, and we focus on prevention and early intervention. Now, where do we do that? That's a good question. So where we deliver our services, that can be in people's homes, it can be in community clinics, it can be in schools, to make sure that we're reaching all of our community. Some of our children who aren't in education and are electively home educated, we will see them at home, or we will see them in community clinics as well. So our purpose as public health nurses is to deliver the Healthy Child Programme. This is a mandated programme that is across the whole of the United Kingdom. So all 4 nations of the United Kingdom deliver the Healthy Child Programme, which is evidence-based, and the core principles of it focuses on giving every child the best start in life, reducing inequalities, promoting health and development, supporting parents and carers of our young people, and working with schools, early years settings and communities. So the kind of structure to the Healthy Child Programme is a universal offer for all families and all children born. So they get an antenatal contact, which we do from 28 weeks gestation. And then we do a new birth visit, which is between day 10 and 14 of the baby's life. Then we will see the family again between weeks 6 and 8. And at the same time, they'll also see their GP as well, who we work closely with. We will then see a child again at their 1-year review to check that they are developing and reaching all their milestones. And we'll talk about diet and nutrition and sleep and oral health as well. And then we do that again at 2 to 2.5 years, but with more of a focus on that school readiness. And then we're moving into our kind of Healthy Child Programme contacts for our school nurses, and that will be our school entry health assessment and the National Child Measurement Programme, NCMP for short, which is what we often call it, and we do that in years reception and year 6. Now that is kind of what everyone gets, and then when families need a bit more care, we will provide more targeted and specialist support from the Healthy Child Programme. And this list that's on the screen now is not is not everything. We just picked some key themes because we do help with so much that happens in those early years and in those school age years. So key topics are infant feeding that we support with, growth, health and weight, sleep and behaviour, emotional well-being, child development, safeguarding, and kind of toileting advice as well. So we have kind of some guiding principles. We do provide a non-judgmental advice, family centered with a focus on strengths. It is really difficult. It can be really difficult when you've got lots of young people in your life or just one young person and kind of adjusting to being a parent or a carer. So we always work based on the needs of that individual family and that child and adjust the advice that we give through the evidence base. So, and we do that in a strengths-based way. So we work with the family because every family will be in a different position and have different experiences throughout their life. The information that we give is always evidence-based and is delivered in a culturally sensitive way. And we make sure that we also have a multi-agency approach because we aren't the only professionals in those families' lives. So we work with GPs, paediatricians, the hospital, and other services that may be supporting families such as social care or our early help areas. I think I might have said before, but we do work in the communities and we offer home visits, and we also use lots of different local community venues. So in our cities and islands, we have our family hubs, and they're starting in Hampshire as well. But we'll also be using places like church halls or community centres so that we can really reach where our communities live and make it easier for our children and young people and families to get to us. We also provide Monday to Friday a duty advice line across all sites where a parent can or a carer phone us and they will get advice from a health visitor or school nurse that day. And we also do offer a texting version of this called Chat Health, but we'll signpost you to that right at the end, which is an anonymous texting service where you can text for some advice and support from a school nurse or a health visitor or a young person, and then you'll get a response usually within the hour, Monday to Friday, 9 to 5. So why does the Healthy Child Programme matter? So you probably have seen on the news all of the time about the nation's health and how things are changing for adults and for children, and how that impacts the kind of what we call non-communicable diseases. So this is their risk of getting heart disease and high blood pressure and things like that. We'll talk about that in relation to healthy weight in a bit, but basically all of the stuff we do is about early intervention so that we're giving a child the best start in life. And these things can include feeding and nutrition, making sure they're getting the right sleep, and being more active around screen time, and also focusing on that home environment and then the wider determinants that may impact that. So housing, income, food poverty, and access to play spaces, etc. So what I'm going to do now is I'm going to hand over to Harriet for the next slide.
Thank you. You're in control of the presentation.
I am. So you say next slide.
Thank you. So as a service, how do we support healthy weight? So we offer growth monitoring, and within the 0 to 5 part, that will look like people, well, as Darren mentioned, the mandated contacts that you have. So always at a new birth visit, we'll weigh the baby in the 6 to 8 check, and the health reviews at age 1 and age 2, but there's also the clinics that are in the communities that parents will come to, and they often come to them because they want to get their baby weighed. So that's how we monitor growth at that point. It may be that they require more targeted intervention, so it may be that they don't get back to their birth weight as we expect, so we would provide a targeted response to that need at that time. So it will vary for everybody, but that's generally how we would monitor growth in the 0 to 5 part of the Healthy Child Programme. And then within the 5 to 19, as Darren mentioned, we do the NCMP in reception and year 6. So that's the National Childhood Measurement Programme. And that gives us the opportunity to measure the children at those points and provide intervention, support and advice at that time. If someone was concerned about their child's growth at any point in their school life, so it doesn't have to be at the 2 NCMP points, then they would refer into our service for the targeted support. So we provide responsive feeding guidance, and this may be used to be sort of feeding on demand, is what you probably would be familiar with. So it's really important that we talk about it, talk about responsive feeding from the antenatal period, so parents have a really good understanding, and that obviously impacts on healthy weight and healthy growth from in utero, by parents having that understanding as their child grows. We provide support on introducing solids. And again, that will be at universal contacts in clinic, or it might be that a parent reaches out and seeks that advice and support themselves. They may access that digitally or face to face with someone within the team. But there are also workshops within the community provided through family centres, family hubs, and things like that. So it does vary how people access it, and that's really important, that they can do that based on their own sort of circumstances and need. As I mentioned, NCMP, they get feedback for that, and it may be that they receive one-to-one support. And that would probably look like a set of targeted contacts with that family, as Darren mentioned, based around strengths and each individual family need. We would give general advice on portion sizes, ensuring, talking about their mealtime routines, how that looks for each family, and how that we could perhaps improve that and promote that to change how things are for that family. Reduction of sugary drinks and snacks, often just sort of targeting that can have a really big impact, because they can be getting those sort of increased calories, I suppose, from additional sugary snacks and drinks that could really help with promoting healthy weight. And encouraging active play, and for the whole family to be more active. So that even comes down to, when we talk about tummy time when they're little, and giving them opportunities to play on the floor, coming up to, when they're toddlers and they start going to the park, and then as children ensuring that they're engaging in PE at school, and if they can walk to school, are they doing that? Opportunities for, it doesn't have to always be organised clubs, it can just be talking about getting out and about and keeping moving, really. And then signposting to local services. So obviously we cover Hampshire and the Isle of Wight, including the city. So there's a lot of different resources and services available in each area. So that would vary, but much of our role is around advising families on what is available locally to them and signposting them to that. Next slide, please. So as we've mentioned, our principles are around offering those mandated contacts, and that starts from the 28 weeks of pregnancy. And within that antenatal contact, one of the main discussions we have is around infant feeding. So we inquire with parents as to whether they're aware of the benefits of breastfeeding, and we give them signposting and evidence-based advice and information about that. They'll have their red books, which some of you may be familiar with, and within that they have a lot of information around infant feeding. And then we would give them advice on how to contact us following the birth of their baby, or whilst they're still under midwifery, they can access advice through that service as well, and just making sure they're aware of how and when to access support to initiate sort of a positive start with their child's feeding. And Darren sort of covered this, where we talk about strengths-based and focusing on the small changes. So if a family was referred in to us and we were working with them on healthy weight, we wouldn't expect, sudden massive changes. It might just be around, that they change from parking right outside of school to parking a bit further around the corner, so they're walking, and having a look at what's in their lunch boxes and is there an easy swap we can make. So it's about little things that are achievable, and we really recognise that how important that is for families to be successful. We work alongside lots of other agencies and professionals, and we'll signpost to them and refer on as necessary, and this is always in agreement with the family. And as mentioned, we deliver the targeted healthy weight and lifestyle support, and staff are trained and upskilled regularly to ensure that they're giving that evidence-based advice and support. So we work with parents and carers, so we would listen and understand their whole family context. You might hear us talking about a family health needs assessment, and that's around looking at what it's not just about weighing a child and measuring a child, it's around really understanding what the impact of the wider family circumstances are for them and how that can impact on the health and well-being of their child. And again, as I've said, we would provide practical, realistic advice that suits them and is achievable, and really celebrating those strengths and those sort of small wins, I suppose you might say. We'd offer continuity and reassurance. So ideally, if someone is receiving some targeted intervention, it would be from a specific part of the team, or they might be allocated to a specific health visitor or staff nurse to carry out that piece of work, and we recognise how important that is for families. They don't feel like they're repeating their story again and again. And we just want to support families to make those informed choices. So that's why it's so important for us to deliver that evidence-based advice. So they've got, they're armed with all the right information so they can make the informed choices for them. So we work with a lot of other professionals. In some areas, our patient record system is linked up with GPs. That's not all areas. We also work alongside the midwives, and that sort of starts in that antenatal period. We would receive a sort of handover and liaison from them. We also may work alongside or liaise with the dietitians, nurseries, childminders, and earlier settings, and obviously schools, children's social care. If a child was requiring that support, we work alongside them as well. And there's also a lot of community and voluntary work that goes on in each of our areas. That is, they do amazing work with our families, so it's really important that we keep up positive relationships with them, and local councils as well. So our vision is that we can provide communities where every child is healthy, confident, and ready to learn, and that we have supportive environments for them, whether that's at home and at school and within their community, and that the benefits from early intervention and evidence-based support are something they can benefit from. We know that their health and well-being is a foundation to the health throughout their life course, as Darren mentioned earlier. So being able to have that contact with families from 28 weeks of that pregnancy, and to talk about, the informed choices around infant feeding, and then moving on to starting solid food, and having all those positive conversations, our hope is that we can start to reduce those risks of those non-communicable diseases later in life.
And I think that leads us to
So, yeah.
questions. But I just to add on to what Harry's just said, we've talked about healthy weights and concentrate on that physical side, but also our early intervention work promotes that kind of parent and child interaction, so it develops those emotional well-being bonds. So there's also the emotional health of our young people for the future as well, not just their physical health as well.
And I suppose when we talk to families around baby brain development and those interactions, that really supports with that responsive feeding. So being able to understand what it is their baby is needing at that point, and might not necessarily each time be that they need some milk. It's really teaching them and helping them to understand what it is that their baby is communicating to them.
So we're happy for any questions now.
Thank you, Darren and Hayley. So if anyone has any questions, this is the chance to ask them now. So if you want to raise your hand or put them in the chat, please do so. I know we had one around baby-led weaning. I'm not sure whether the lady who asked that was on the call. But in the meantime, if there's anyone else who's got some questions, please do ask those now. Otherwise, it's going to be a very short session and we can...
Should I just talk about how to access our service a bit more in case that helps people have more time to think about questions? Maybe that might help. So we've just put one of our main websites here, which is that very long email web bit for our Hampshire and Isle of Wight NHS Foundation website. that gives you the kind of landing place for all 4 sites. But I can assure you that all of our families in the different 4 sites will have very easier ways to get onto where to access information for us, because we tailor it in their red book on where to do that, depending on where they live. So, for example, in Hampshire, they will have, oh, that's a good question. I will talk about that in a minute, about the red book. In Hampshire, they will have Hampshire Healthy Families, which is our main landing page and gives direction to your local health visitor or school nurse. And then in Southampton, Ports of the Island, we have something called Family Assist, which does the same thing as well, and has resources just as the Hampshire Healthy Families one. But if we'd put all of that on this slide deck, we'd still be here another hour as I go through all the different bits. But obviously, it's tailored for those local families for them. Was there a question in the chat there?
Yes, there was. There's one from Zenda saying, is the red book being phased out?
Yes, that's a really good question. So many of you, or probably if you've had children, know the Red Book that's been around for many, many, many years. And we went through a phase where parents absolutely loved their Red Book and filled out each bit. And I think as we're moving to the more digital world, parents get their Red Book nowadays, and then they tend to forget but they've got it because they've got so much other stuff going on. You know, the NHS has a real drive, especially with the 10-year forward plan, to move to giving our families and those who use the NHS more control over their health through digital portals. So many of you, well, you all have a GP or know that you access your GP through your NHS app. So we do have, in Hampshire, we have built a parent information portal, where parents can see immunisations, get information, and plot and see the growth charts of exactly the same as you get in the Red Book. And as we move forward with the development of the 10-year forward plan in NHS, there are developments to how that looks and works for parents nowadays. So in short, that it's not being phased out currently, but we are looking at different things to replace that meet the needs of our family in line with the direction of the NHS. Does that answer the question? Hopefully.
Thank you, Darren. We've got a question from Sharon.
Hi, I know some of you, I recognise some faces, but I work for a charity called Energise Me, and our role is very much around trying to support young people to be more physically active. And I guess my question to you is, as professionals that are working as health visitors and school nurses, what support would you like from us? You know, we talk all the time around 60 active minutes, 180 minutes for 0 to 5-year-olds, but how do you share that message with schools in the work that you're doing? I mean, I noticed on the things you talk about encouraging active play and whole family activity, but how do you actually do that?
Yeah, that's a great question, Sharon. And yes, we've worked with you, and we definitely embed Energise Me into all of our bits, because we've worked in Hampshire around the different projects. So that is embedded in the care that we give to our families, the presentations and the sessions that we deliver in our schools, and how we signpost. I haven't gone into the specifics of that today because it is slightly different in all 4 sites, and I didn't want to just focus on a particular site and confuse people, if that makes sense, Sharon. But yes, definitely, all the education and training that we give to our workforce, what we've learned from Energise Me and our recent project that we did, is all embedded in there, so they give that advice and guidance out. And in our one of our sites, we're partnership with a charity who delivers particular walks, and that's embedded in that as well. So yeah, so we carry on having your support, Sharon, and we work closely with Energise Me in our school settings, but also in our under 5 sections where we've managed to embed that as well.
Excellent, so, yeah. Thank you.
Right.
Thank you, Sharon. Are there any other questions at all? Maybe can I ask a question to the audience? Could you tell me what brought you to this session today, and has it delivered what you were expecting? You can just put it in the chat if you want. Got Zenda's typing, so yeah. Or you can come on and tell us.
I feel like I'm going to get a star rating at the end of this.
I just think it's really useful to know exactly who's doing what where in the system. So that, I mean, that's why I signed up, really, just to re-educate myself, I guess.
Oh, that's interesting, Zenda. So Zenda's a registered childminder who's looking for a role as a community nursery nurse. Darren.
Oh, fantastic. Please do get in contact if you're interested in joining us as one of our staff. We're always looking to how we can develop and expand our workforce. And you've got great experience as a childminder to bring to that. So yeah, please do get in contact.
And Norma's got her hand raised.
Yes, hi there. I'm due to start a new position as a community nursery nurse on Monday. So I just thought it would be a good way to pop online and see.
Oh dear.
It's a totally different field of work for me. I've been working in the neonatal unit for 17 years in the NHS, so it's a slightly different role, but it's just interesting to see what it's all about, really.
Fantastic. Congratulations, Norma. We look forward to you starting on Monday. Do you mind sharing which part of the county you're joining one of our teams, or?
So I'm based in Fleet Hospital.
Oh, fantastic. Yeah. Okay. Well, you get top marks. This is part of your introduction then already. So yeah, you're getting a good overview of the service. So yeah.
And we have a question from Katie.
Hi, yeah, mine was similar really. I'm the lead for engagement for the Isle of Wight division. So I go into communities quite a lot and go to like coffee mornings and family hubs and talk to people, and similarly work a lot with our local VCSE groups. So even though I'm predominantly working for the Isle of Wight division, I find it really useful to hear what's going on in our other divisions and with our other services, because when people have an issue or something in their own lives they want to talk to me about in regards to the NHS and services, I kind of need to have just a bit of knowledge about, each service, how they can get in touch and what they do, just to kind of make them feel supported in that first contact. So thank you for putting these on and letting me come along, because it's been really interesting.
Katie, can I just mention some names for you? So we have participation leads in our division who work in our communities. So they might be good to link in as well, because that's similar to the work that you're doing. So a lady called Lorna and Ratcha are part of our participation leads for 0 to 19. So yeah.
Very lovely. Yeah, it might be good for me to get in contact with them.
Yeah, that'd be great, because they're always looking for feedback from our communities as well. So it sounds like that's your best place for that, Katie. So thank you.
Perfect. Thank you. Yeah.
Right, so most of it is around awareness of what the services we offer. So hopefully today's session has delivered that. Whether you're working directly with children or in a community that might ask for help around their children. So are there any other questions at all, or any things that you wanted to talk to Darren and Harriet about today? No? Okay. Well, can I take the opportunity to say thank you to Darren and Harriet for their presentation today. We will be sharing the slides late this afternoon in an email to you all, and I also will enter a quick feedback form for you to just give us some sort of formal feedback on the sessions today. And just while I'm on, I'll just sort of do a bit of a plug for, we've got 2 more sessions directly for members and staff. One is in March, which is the 24th of March. Again, details will come out, but that one's going to be all on a falls prevention. We did run one last year and it was very successful. So this one's more about falls prevention coming into spring. We had one on the winter kind of falls, for this one's around spring. And then in May, we have one during Mental Health Awareness Week with our partner organisation, Solent Mind. Very popular session last year. We ran 2 sessions, and this one is all around 5 ways to stay mentally well. So if you want to join either of those 2 in March or May, I will email out the links to you. I'm sorry, I can't put links in the chat for some reason, because my computer says it's got no memory because I'm recording all you lovely people. So we will follow up that with an email. And as ever, if you've got any suggestions for any topics you'd like us to cover in these sessions, then we'd be grateful to receive those ideas. So if there's no other questions, I think we can probably stop the session today, and thank you all very much for joining us today, and hope you have a really good rest of the day. Thank you. Thanks, Darren and Harriet.
Thank you, everyone.
Thank you. Bye.
Thanks. Bye.
Thanks. Bye-bye.